Hi, this is Evan Elkin, Executive Director of Reclaiming Futures, and I'm here with Ashley Nguyen from Ticket Health in Vancouver, Canada. And we're going to do a brief demonstration and discussion of a new remote screening tool called Here to Help. Here to Help can be taken by a respondent anonymously, but the respondent can also identify themselves at the end of the tool, as you'll see, if they wish to be contacted or need some extra support. And that feature is made available by the user implementing Here to Help. This is an example of a welcome screen from a school district that uses Here to Help for adolescents. The tool can also be used for adults, teachers and staff in a building, or any adult really in the community. Start by accepting the terms that are laid out on the home screen for this particular implementation. As always, we start with a reminder of where someone can call or go if they're in an emergency situation, since this tool is really not meant to be a crisis intervention tool. The tool is organized into categories: stress and emotions, health and safety around COVID-19, family and friends, school-related, racial equity and justice, and someone can decide at the very beginning or after they've gone through one or more of these categories that they're done and they simply want to see resources. They can choose to see all the resources right away without answering any questions as well. Let's start by looking at the health and safety category. You can see there's an array of responses. They're not mutually exclusive. I will opt to say someone in my home is sick with COVID-19 and advance to the next slide, which asks which of the following things have happened. I will indicate that I've lost a loved one, which is a common occurrence during COVID. At one of our schools, we found that 18% of students checked this box. With the loss of a loved one, you have an option to talk about how you may be feeling and or coping. I will indicate that I'm feeling depressed as a result, and that I'd like to see some resources at the end of the screening. We'll check one more category just as a demonstration, one that would be related likely, stress and emotions. And this is a question about coping. I'm getting through tough times by, and I will indicate that I've been drinking and using marijuana and drugs. You can see on the previous slide that there were also some positive coping strategies someone might use. Over the past few days, I've been feeling depressed and down in the dumps. And as I indicated previously, substances, this is a frequency question. I will say that I'm using substances every day and that I am concerned. We give the option of someone telling, indicating that they're not concerned about their drinking, and some other features. I've been drinking more than usual, which would be the case for the person that I am demonstrating with responses right now. So again, asking would I like to see resources? This is one of the main built-in features of this tool, is that for every topic and category and or difficulty reported, the tool asks the respondent if they'd like to see resources at the end. That's really one of the main purposes of the tool, is to efficiently deliver customized resources based on what the person wants to see and what their needs are. Over the past few days, others that I care about are feeling, and we include this element so that people can think about their loved ones or people that they're or their dependents or their friends that they might need some help to, and get some resources for them. So let's say that someone else in their household is also feeling the same way. Might be the same resources that they see, and the person may have bypassed the questions about themselves and skipped to that one for whatever reason. There is a built-in feedback section here around stress, asking the person, would you like some tips on how to handle stress right now? This is a common feature of a lot of the Ticket Health tools, and we included it in this particular Here to Help tool. So let's say yes to this, and I'll show you some of the tips. So sitting at your computer, you read along with these. Close your eyes and think of a happy memory. Stretch, set your arms up and to the side. It's a common kind of mindfulness activity. Go for a walk. Another mindfulness activity is taking deep breaths with your hand placed on your chest. And so people can opt out of this, but we just thought we would include it, since in the here and now someone might be feeling stressed out. So we'll just use those two categories. We'll click I'm done now. Let's see the resources. You can have them emailed to you, or you can just view them on the screen. If someone doesn't feel comfortable receiving an email, doesn't have an email address, or doesn't have a private email address, they can just view things on the screen and note down on a piece of paper privately what they want to write down. So gives you a choice of which resources. So even if the person had decided to opt out of the rest of the screening tool and not answer any of the other categories, they can still see all the resources if they wish. So for now, I'll just say I want to see the resources related to stress and emotions, just to streamline this demonstration. First thing that pops up on the screen is these, and these are localized resources. Whenever a community or an agency decides to implement Here to Help, we will work with them to tailor these resources to their actual community. You may include some national resources that are common to a number of different communities or agencies, but the idea behind Here to Help is to customize it for the user so that the resources are current and local and accessible. So if you click on these, they will take you to the websites of these organizations. And again, we remind folks, if this is an urgent situation, these are the numbers to call. We bookend that, put it at the beginning and at the end of the tool. And here is the opportunity. In this particular implementation, they did have a team ready to respond if someone chooses to be contacted and needs some help either navigating resources or some counsel. So let's say yes to show you the contact page. Choice of how to be contacted. This person wants to be called. Again, privacy is something we're mindful of. Can we leave a voice message? This person may say, no, that's not comfortable. Don't leave a voice message. Just wait till you get me directly. And we conclude with contact information page. So as I said before, you can remain anonymous and choose not to be contacted. But if you do want to be contacted, you need to put, you can put a first name or a nickname and a phone number, but you need to put something down in order to be contacted. So now we're going to transition and have Ashley Nguyen show you some of the back-end reporting and analytic functions of the tool.
Thanks, Evan. As he mentioned, I will show you the back end of the data and analytics portion of the tool that you just saw. So right here on Ticket Health on the dashboard, the first thing you'll see is a list of reports. So I have a couple of the test Here to Help reports that I have filled out. And right here, you can see the one that Evan just completed. You get real-time data right onto the dashboard as soon as the person completes or submits. So on the homepage, you can also ascend or descend by flags. And so this helps with triaging or trying to understand the urgency and the level of care needed. So let's take a look at Evan's here with 1 red flag, 9 yellow flags. So the report is pretty simple with the questions on the left side and the answers on the right side. And right up at the top, all the flagged question responses float up so that whoever is, taking a look, it could be a counselor or something like that, they will see that this person has a loss of a loved one, they are feeling depressed, and they're coping with drinking alcohol and other drugs. And then the rest of the questions follow below. So another great feature on Ticket is the aggregate data analytics portion. So here, it's actually great because you can take a look at the data in a bar chart format. So right here from those sample reports, everything aggregates together, and I can see that 67% of those 3 submissions experienced loss of a loved one. These are the percentages of those different feelings that people felt with the loss of a loved one, some coping strategies. And you can also click into a bar chart and see exactly which reports or individual submissions answered in that way. Another great feature is that you can filter by a specific question. So let's take a look at when someone answered that they lost someone and they were feeling depressed. So here you can kind of see maybe a correlation or association in terms of the coping strategies with someone feeling depressed with the loss of a loved one, or how they've been feeling the past few days. how often they were drinking and using substances. So again, that can help with triaging and understanding the urgency.
Thank you, Ashley. So as you can see, the Here to Help tool also has some pretty powerful reporting and analytic capabilities. So you can prepare yourself as a counselor for someone who wishes to talk to you, and or take a closer look at your population and some of the trends and correlations. For example, the example that Ashley showed us, taking a look at all the people who have had a loss due to COVID and what kinds of coping strategies they seem to be using in aggregate as a group. So thanks again. If you're interested in hearing more about Here to Help or any of the tools that Reclaiming Futures and Ticket have, you can contact us through the Reclaiming Futures website, reclaimingfutures.org, or at elkin, E-E-L-K-I-N, at pdx.edu. Thanks very much.